Thank you, Dr. Gopal, members on the dais for giving me this opportunity to talk to you. I'll be not only talking about experience in an Apex institution as a tertiary care center, but also as a center where we are training, teaching, and bringing out the largest, probably the world's largest residency training program. So we are in an Apex, we are looking at a lot of different levels which we are looking to tackle, to encourage, and to make them into leaders. So firstly, leadership is like beauty. It's hard to define, but you know when you see it. So that's what, it's very difficult for me to tell you how a leader should be. It's always by emulating, by seeing a leader that you realize what are the real qualities that define and make a leader. So we are looking at departmental and institutional head leaders, we're looking at middle management doctors, and then we are looking at the level of junior doctors, residents, fellows, and even undergraduates who are coming and getting trained and are seeing and are forced to develop leadership qualities. And why leadership qualities? I mean, why do we need it? As medical professionals, it is not only an opportunity but a duty to be leaders. We need to be leaders to be successful in our profession. A leader who has a social responsibility, because we need to speak out on health issues. We need to discuss as a team with the patient, the attendants, about what is expected, what we want from them, and what they can expect from us. All these are leadership qualities, and all these require you to have these leadership qualities. So it's not only for a patient or for the society or the general public at all, but on a daily basis, when we discuss and talk with our patients to convince them to follow what we are advising them, it is the making of a leader. So it's essential because we need to make it a vibrant medical profession. We need to develop a critical mass of doctors who are prepared to be involved in these leadership roles that can influence not only the future of profession, but the healthcare industry in the entire country. That's why leadership qualities at every level in an Apex or in any teaching hospital, it is required. We need to tell them how to have out-of-the-box thinking. The regular rote method that got us through MBBS is not what gets us through a postgraduate MD, MS, or DNB. We need to think and try and evolve what we are learning and apply it to each and every patient that we are seeing. So that is why it is not only essential, but a part of training. It should be a part of training at every Apex or a teaching hospital. We need to promote improvement within the context of available resources, particularly so that we develop them for the Indian setting. Coping with a change is a challenge, and that defines a leader who can influence that change and make self and his group adaptable to the change. The concept of collaborative leadership is now what is essential in any a group where there is a hierarchical order. It has to be an inclusive style of involving everybody rather than a command and control form of leadership. The leadership is through influence and not authority, by creating a shared purpose, a common vision, and not because of my position of power or importance as a head of the institution. It is important to build the basis of relationship in each and every component who is there in the collaborative relationship that we have. And how do we get it? There is a background of hierarchy in every institution, more so in an Apex institution like RP Center. We have right from chief down to, like I said, undergraduates who come for training, and you have so many, a huge mass of allied medical healthcare professionals who need respect, dignity, and an ability to work together. For residents, you need to show an increasing transfer of responsibility. They should be willing to take responsibility, and we should be willing to give them responsibility. It is that responsibility that will bring about a collaborative relationship and a collaborative feeling that we are part of a team. You involve the residents in the OPD, the clinical work. Ask them to take decisions. Supervise them. Do not write for them. It is that teamwork where the junior residents are working supervised, whether it's OT, working up patients, or deciding the management of patients. It has to be a collaborative teamwork that is essential. The seniors are responsible for their junior residents. The senior residents or fellows have to ensure that the residents training under them get that requisite ability to become independent doctors and perform their medical services to the best of their ability. They need to be there always to handle complications and problems that they may face, or any such situations that can come, including a frequent challenge now to the authority or to the voice of a doctor by attendance of patients. Involving in the resident associations to make them not only the residents but as advisors, to be part of them, to give them direction as to how to work towards creating a better environment for the residents in the work environment. Make them part of committees that are responsible for the growth of the institution, including involving them in extracurricular activities. The influence of any individual is to their subordinates, to their superiors, to peers, and to patients. And that is the group collectivity that we need to create. And leadership is a philosophy that needs to be made. It should be part of a program, and it should be implemented as a practice in any institute, particularly in apex institutes where there are hundreds of people who are getting involved in this teamwork. Therefore, it's essential in an apex institute to understand collaborative leadership rather than the top-bottom that we frequently see in our country. Thank you.